introverted. They will not want to go out
Mm-hmm.
with a lot of people, as well as how the society has accepted them or has not accepted them per se,
Mm-hmm.
because we do still find that there are still a lot of stereotypes around the whole HIV and AIDS
Mm-hmm.
concept. Most people are not as much as supportive, and we still do find people that just think that it's somehow contagious by just sitting or being around someone that is HIV positive, whereas that is not the case. So you do find that people will not now want to go out as much as they used to, because they now have that fear of being pointed wherever they go. Even in the streets, you'll find people, they just, or once you cough, they'll just assume that you are now sick, stuff
Mm-hmm.
like that. Yes, so you do find that socially people will just try to keep to themselves, which in turn will hurt the person more than just accepting. People still do not accept
Mm-hmm.
easily. Yeah.
Yep, that's exactly it. So we see that it's a multiple layered problem, right? You have what's happening inside your body, then you have what's happening inside your mind psychologically, then you have what's happening inside of your community, right? And all of this shows us that it is a huge social issue with HIV/AIDS, right? Because yes, we are learning to be kinder to people and to accept it and not have stigmas, but a lot of society still does have stigma, and a lot of them still treat you differently, right? Whether it is you cough and people like look scared or something like that, that then affects you again psychologically, and then you don't trust your body anymore, right? So this is a huge problem, and in the social element, or not in the social element, within this model, a social worker plays a role at each and every step of the way, right? So, just as a last recap question before we go on with today's stuff, I'm going to ask you to discuss with me the role a social worker plays in each section, right? And it's going to try and think a little bit about it. And then let's start with medically. So, Shakir, we'll go back to you. Medically, what role does a social worker play in terms of the medical side of things?
So the social worker will look at obviously what medication has been given to the person, right? Prescribed
Mhm.
medication, the prescribed time, and make sure that the person is taking this medication on the prescribed times. And obviously, it's going to be difficult for the person to now renew his lifestyle and take this medication, all of that. And so the social worker is going to give him support in taking the medication at the prescribed times in the prescribed manner,
Mhm.
and not feeling down about it, and helping the person get through these tough times, and just being a new norm in this person's life.
100%. So, on the medical level, the social worker is doing a few things. They are making sure that you understand the importance of your medication. They make sure you understand what is happening inside your body, because a doctor will speak about CD4 count and a viral load and this number and that number. And a social worker brings that down for you to make you understand this is what it means and this is what is happening, so that the person is medically empowered, right? They make sure you take your medication, that you have somebody to talk to about your medication, that you understand the side effects, if there are, which nowadays is very few, and they can work through it. Okay, so that's all medically, right? Safia, psychologically,
Mhm.
what does a social worker assist you
So, they probably provide counseling.
in? Mm-hmm.
They deal with the emotional distress
Mm-hmm.
that the person is undergoing. They probably do some form of therapy,
Mm-hmm.
whether that is, I don't know, art or talk therapy or whatever the case may be. But they act as a receptor for the person to be able to vent and air their feelings out. Um, and basically, what you call this, educate the person on the importance of understanding that it's not a death sentence. You know what I'm saying? There's life beyond it. So yeah, I think counseling, acting as an emotional pillar, and helping them um, become resilient against the discrimination, against
Mhm.
being ostracized, and
Mhm.
accepting what they have, whether it's HIV or AIDS, accepting what
Yeah.
they have. That's the important part, because until they don't accept it, they're going to be affected by being ostracized and stigmatized and all of those type of things. So yeah, psychosocially, yeah, counseling and just building resilience and so on and so forth, I would think.
So they do number one, the uh, immediate counseling, right?
Yes.
You've got your results. You're about to go test. Sometimes it's pre-test counseling and post-test counseling that they might be
Yeah.
involved in, and then it's helping you understand what this all means again, and then
Mm-hmm.
helping you face your own anxieties, your own fears,
Yeah.
your own worries, and
And
providing
also,
that support for you. Yeah.
yeah, I think also the social worker would be tasked with configuring a way for them to tell their family or their
Mm,
partner or whatever the
yeah.
case may be, which can be, whew, I'm sure, very, very, very distressing. So yeah,
Mm.
talk about that and plan how they're gonna go about doing it. Because I mean, nobody is gonna take it easy if you just walk in
Well,
one day. "Oh, okay, everybody, I got
yes.
HIV/AIDS. It's not contagious like that. Don't worry about me. So I think
Mm.
that a lot of the psychosocial aspects would include first strengthening them and their acceptance of it and educating them on living with it, and then how they're going to um, give the message over to those that are near and dear to them.
Okay, so that's working individually with the person. Moya Beng, um, I'm going to ask you now socially, right? With communities, the social worker also plays a role within the social element of it. So explain to me what role a social worker can play there.
Okay, thank you, Nick. Okay, I just think maybe as a social worker, I will give the person the moral support.
Mhm.
The moral support and help, like Sophia just said now, to help her to live with this, to accept this emotionally, and then even to help her or him to introduce this to the family, to give him or her the way how to tell the family, because to honestly
Mhm.
it's not an easy thing. Sometimes other people, they will keep themselves until now it's getting worse as you don't have
Mhm.
the support from the family.
Yeah. Yeah. So I think one of the best ways to see it in terms of socially, right, is that this is where the social worker becomes a activist, right?
Nick,
This, yes.
you echoing.
Oh, sorry, Moyabeng, can you switch off your mic? There we go. Is this better?
Yes, thank you.
Okay, cool. So on a social level, the social worker is firstly an activist. They help educate communities and people about what HIV/AIDS is. They help them understand their prejudices. They help communities understand the use of protection, the importance of protection, the importance of antiretrovirals. They help communities through education programs and activism programs. And they also become a safe space where the community feels like if we want to understand HIV/AIDS better, if we have somebody in our family who's struggling, we can go there. So Moyabeng, you're on the right track. They do a dual role where you're supporting the person and the community in tandem with each other. Okay, well done. It seems like we are well on the way, right? A very important element to understand is that internationally we have a goal, and we are getting there. We are really getting there slowly but surely, right? We have a goal that 95% of all of us in the world know our status. 95% of people who are positive are on treatment, and that 95% of the people on treatment are virally suppressed, which means that it doesn't show in them anymore. All right, and that's amazing. Right, we've gone down in the last few years from 59 million people. No, we haven't. Sorry, that's a false start. Currently, we are on 39 million people. It was much worse. We've now gone down to 39 million people, but it's quite important to understand that 13 million of those come from very poor and middle income countries, right? So there's definitely a social link between poverty and HIV/AIDS, right? Which is why it's a social problem again. All right, Leanne, I think that's enough recapping. Let's go through to today's presentation. Okay, can you go back 2 slides? All right, so I want you to understand pill fatigue. Did we do pill fatigue last week? I think we did, yes. Pill fatigue is when you are tired of taking pills. It is a thing, right? We see it very often with people taking antidepressants. We see it very often with people taking ARVs. Is you get tired of taking a pill every single day. Your body becomes fatigued by it, right? And a social worker's role is huge there, right? Also, the importance of disclosure of safety. The social worker's primary job is to the client, and we should always make sure that it's safe before they disclose it to anybody. All right. Then we looked at the bridge of support, I believe. No, family system. So it all begins with supporting children living with HIV, helping them understand it, moving towards family counseling, and finally towards caregiver support, because caregivers do struggle with burnout. So I want you to imagine that somebody's partner has HIV, all right? It is very difficult to look after their partner with HIV or AIDS, and at the same time worry about them the whole time, because you're worried about their health, you're worried about the future, and you love them and care for them, and you have to take on extra responsibilities because their health is sometimes going low. So the caregiver burnout is quite important, right? We are luckily not alone in this. We are supported by all sorts of NGOs and practices, and we're going to get into that a little bit. Next slide, please. Okay, so just like caregiver support is an important thing to understand, and caregivers can burn out and get tired, the social worker can also burn out and get tired very quickly if they are not referring people onto a system. So social worker doesn't work in isolation, especially an auxiliary social worker doesn't work in isolation. All right. They work with ART clinics, they work with community health workers, and they have referral systems such as SASA, different NGOs, and different little spaces that they can work with and through to help them better provide these services. Next slide, please. Okay, let's quickly check this. All right. Bule Van Roy, you with us? Can you tell me quickly, off the top of your head, can you mention an NGO that deals, or an organization around you that deals with HIV/AIDS that you can refer people to? What do they do? Who are they? And I'm going to ask each of you to think up one quickly, because there are many, but we need to shake up our brains a little bit. Bule, can you think of one?
In my, oh, sorry. In my area, I know of Cindy's network. It's Children in Distress. They do work with mostly kids affected by HIV and AIDS. They are in Pietermaritzburg.
Yeah. And are they an NGO type clinic where you can just go there and get information, or do they have a children's home or something to that effect? I don't know if you know a lot about them, but just I've never heard of them.
I know that they work mostly with people that run creches or daycare in disadvantaged
Ah, I've lost you there, and it's so interesting. Can you try again?
communities. Sorry, I'm saying I know people can actually go in there. I've actually seen some ladies were referred by another lady that runs a creche in their community. So they actually needed help with another child that the parent had recently passed away uh, due to HIV and AIDS. So they do help. And I also do know that they were funded by USAID most
Mhm.
of the times, yes. So they are an NGO in Pietermaritzburg.
Ah, okay, that is very cool, and you'll find a lot of USAID to support HIV/AIDS projects in South Africa. Shakir, which organization do you know that provides some sort of support?
Uh, the one that's quite famous is Treatment Action Campaign.
Okay, what do they do?
This one they they like a group that campaigns for access to treatment for HIV positive individuals and monitor the quality of services in like public clinics and stuff.
Okay,
There's also,
okay, yep.
there's also AIDS, like AIDS Foundation of South Africa. That's around the same concept.
So they go and they work in clinics specifically.
They have clinics.
Oh, they
So
run clinics.
they facilitate like the access to treatment and social services and
Yeah.
stuff.
Okay, that's amazing. Good. Safia.
Okay, so my favorite one is CHAPS. I don't know if you know CHAPS,
Nope, never heard of that.
the Center for AIDS Prevention Studies. Um, and the reason why I like it is because I have a friend that is a data analyst and a microbiologist, and they one of the main ways that they campaign against HIV/AIDS advocacy and all of that stuff is that they offer free circumcision to males of all
Okay.
ages, um, and it's completely free. They don't have to pay for it, which obviously reduces the risk of infection because um, I mean, we can think there's no storage place there for stuff, right? So it's a PBO actually. It's not an NPO or NGO, but they do amazing work, and they actually manage to get high-ranking medical professionals to volunteer for them, and that's what allows them to be able to give the care and the circumcisions for free and so on and so forth. And they have great stats also on um, the different aspects of AIDS and all its related things that come with it.
Okay, that's quite cool. And are
Is
they
it,
local?
is it called
Are they national?
CHAP,
is it called is it called CHEPS or CHOPS?
CHAPS. So it stands for Center. Uh,
No, I'm joking because they do the
oh, okay.
chopping, so I thought it's called CHOPS.
No,
Oh, because of the foreskin. Oh, that's terrible.
no, no.
All
Yeah.
right,
So they also do
Leanne.
free HIV testing and stuff like that.
Okay. So you've got testing. So far, we've covered. We've got testing. We've got support for
Circumcision.
children. We've got clinics that are running. So we seem to just between all of us be able to put together quite a few resources already. Yeah, do you know of any organization that works along with AIDS and what they do?
Yes, I do. It's a Seaware Disease Hospital in Joburg. They are HIV/AIDS clinic. So what they do is they support anyone coming in there. So it's a free clinic. So they offer counseling. They offer like mental health support, mental health screenings to make sure that you're fine. And then they also give out medication if you can't afford any medication. They also like speak to the families if you like if you're not in the right mindset to go and speak to, let's say, your wife or your mother or whoever. They will actually then arrange uh, like a meeting, and then they will explain to the families what HIV and AIDS is all about, and then give them the myths and the actual facts about it. That and they're also an NGO, so yeah. And they've got doctors, so it's
Okay.
not sisters and nurses that works there. They've got actual doctors, and then they also have like I don't know how to put it, like a sexual health clinic
Yep.
to offer support in that area as well. Like if you need protection and so on,
Mhm.
and advice. So yeah, and they're in
Perfect.
Joburg.
Okay, and they're based in Johannesburg. Moya Beng, tell me about an organization around you.
Yes, I'm staying in Nigel, ne? In Nigel, but at Elra Park. So we have NGO here. The name is Uratilwe Center. The clinic here around at Elra Park, they usually send the people there. Actually, after you discover that you are HIV positive, they send the people there for a moral support and for the food. Every day they cook, and then they give the people that they have HIV the food every day, and they help them even for others. They don't have IDs. You won't believe this. Others they don't have IDs. Then
I
they
do
help
believe
them.
it. Yes.
Then they help them to get the IDs. And then others they don't take their treatment. Then as they have a list, they know who is who. They visit them. They visit them and give them morale that they must take their treatment. Actually, they help them a lot.
I have a
Okay, that
question.
is amazing. Yeah.
Mm.
I have a question for Moya Beng.
Yes, my
Um,
dear.
I lived in Nigel for the past 8 years, and I didn't know about the center. Where in Alra Park is it situated?
Is there where was an old school of what is those? There were old school. I forget the name of that old school. I'll remember that old school. It's old
Okay.
now. They use for the center now.
Okay.
Yes, they
All
use
right.
for the center. I will remember it, then I will let you know now.
Okay. Thanks.
Yes, my dear.
Okay, perfect. So we've seen that there's a lot of community support. We've got, this is just us thinking, not even very hard. That's just us coming together, um, thinking what is immediately around us. We have to go one step lower and look at what is in it for the social worker, right? What is your support system? Right? Because it can get a lot. If you think about it, you are carrying on your back people's fears, people's worries, people's concerns, their anxieties, their stresses, right? And you're not only dealing with one. So we worried about a caregiver who's fatigued because her husband or his wife is sick, right? That's one person. You will probably in your career within a year come across tens, if not hundreds of people that are ill, right, with HIV. And you need to carry each of those families and groups. So you do need support. So number one, and the reason why I want us to focus on this is because I do see a trend and I want us to stop it. I see a trend where we are too afraid to ask for supervision, where we are too afraid to ask for support. All right. And that is such a dangerous trend. We feel that we will be criticized. We feel that we won't be considered good enough social workers or psychologists or teams because we've asked for support. And that is something that is not true. So number one, you have supervision. Supervision isn't there. It's not a building site supervisor to make sure you're building correctly, right? They are there as a safe space for you to be able to explain what you are feeling and what you are going through, right? In the process, because you get primary trauma, and primary trauma is I found out I have HIV/AIDS, and boom, I'm traumatized. Then you have secondary trauma, which is the people around me who are dealing with my case also have trauma to deal with because of it, right? And the person who deals with that is their supervisor, right? A person who is senior, who has more experience and can guide us and listen to us also. Then some cases are very complicated. There's children involved and grandparents, and maybe there's some prostitution accusations and all these types of things. A senior supervisor usually helps you navigate that better. All right. Then, so that's primary. So number one, the social worker is in the middle. The first layer of support we have is your supervisor, which is your direct superior. It is very important that you insist on supervision. That you say, I want somebody that I speak to every 2 weeks or every week or every month to help me get through it. All right. Next one is a multidisciplinary team. This is where you will find a lot in more organizations, but where you sit and you share the care burden. All right. So you sit, I know in Limpopo we used to do it a lot. I don't know how it's done in different clinics, but you have the psychologist, you have the doctor, you have the nurse, you have the social worker, and we all sit as equals around a table. And we all say, I can contribute here. I'm doing this. This is my report. That's your report. And we help each other professionally so that you're not isolated. So that it's not just one social worker working in a community without others. Sometimes it means you need to create that network. If you're in a very isolated community, you may need to create that network around you. And finally, community organizations, right? And what that means for you as a social worker, once you're qualified and once you have your position, the first thing you should be doing in the first month or so is going around and saying, let me go visit these NGOs. Let me put my name there and let them know that I'm available, but also see what they can do to support me. And you walk in and you say, hi. When I have a client with HIV, what am I going to do? How can you assist me? How can I assist you? And you build up this network of people around you that you can trust to assist you in maneuvering a client through them. So instead of you sitting there and going, where's this client going to go? You already have built those links, and the burden of care is so much less on you. You need to have these things in place before you go full on into facing the HIV/AIDS pandemic. Shakir, how can I say?
Okay, so just to add to what you are saying, all right? The simple concept of
I cannot hear you. Try that again.
it is called care of the caregiver. You not the second one that you talked about, multidisciplinary thing. What's it called? Can you hear me?
Mhm.
Hello.
Multidisciplinary teams, yes?
Yes, multidisciplinary
Yes, now I
teams.
can hear
First
you
time
much
I heard
better.
it was
Yes, so much better.
okay. Yeah. Yeah. So did you hear the last part? Doesn't care for themselves. They never able to serve anyone. All right, there's the one part. The multidisciplinary team, the first time I heard it was when we were on the phone. Sophia mentioned it, and she was calling for it all the time. And these people just wanted monopoly over it. But the multidisciplinary team brings in different points of views where you may not be able to see. You know, I had to set a paper, and one of the subjects was actually HIV. And I used our class of last week in that lesson. Nevertheless, I set the paper. I went to the HOD. There were no mistakes as far as I knew, but she found mistakes. That
Mhm.
was the first draft. The second draft, when I went, she found mistakes that she made, and I had to go with the third draft. So
Mhm.
the multidisciplinary team brings in multiple views, where it's not just you seeing it from one perspective. You're seeing it from multiple, and that can be an accountant in the board, a doctor in the board, a lawyer in the board, different teams of different uh what you call it, job descriptions, etc. That's the best word that can come now. So yeah, care of the caregiver and multidisciplinary teams, these are two very important parts. And the third one, I forgot the third one. You can remind us.
Yeah. So the importance of multidisciplinary team is that you do not know everything all at once, nor are you expected to know everything all at once. And the team makes sure that we all share information around each other in a way that's reasonable. Of course, this is ideal, right? It is ideal, and we wish everybody did this in this way. Very often, it means that you need to go and fight for it to happen that way. Okay, let me be completely blunt with you. Very often, you need to set the team together and fight and argue that it happens. All right. Let's look at more practical, come down a level. What is important to know when dealing with people with HIV? Number one, clients expect you to keep confidentiality. You never share a status with anyone. Anyone, period. It is not yours to share.
Can I say
Right?
something?
Yes, of course.
It's actually illegal to disclose somebody's
It's
HIV
illegal.
status without their
Yep.
consent, and it's illegal to even ask an employee if they are or not HIV positive. It's like,
Yeah.
yeah, it's bad. You can get sued. You can go. It's bad.
You can go to jail. You can go to prison. Right? It is very important to understand that it's not just consent, it's explicit consent. Right? Which means that it is in writing, it is recorded. It is find 3 ways to confirm that you have consent. And even then, don't do it, is my honest advice. Right? The client status is theirs, it's their story to tell, and they will tell when they are ready to who they wish to tell.
Okay.
Right? Especially when we consider the fact that there's social risks involved and you cannot protect them from all of that.
Okay.
Yes, sorry. Okay.
Can I throw a spanner in the works?
Of course.
We've had many situations where people, customary in Muslim marriages, there's not dating. So people get to view you view them. It's like an interview that's happening, and then you go pray about it and you decide, am I going to marry this person or not? So we've had lots of instances where people were HIV positive or had AIDS and did not disclose this to the other party. And sometimes it would come back to us to bite us in the backside because we play matchmaker, and say like, you knew about this, how could you not? It's my child, it's my daughter, it's my nephew, whatever the case may be. What are ways that we can use to inform people subtly, without being sued? Because I mean, honestly, like, how do you just sit back and watch a person's life being thrown away, and what's about to go down? Like, it doesn't sit well with me.
Okay. So there's a few principles to keep in mind here. All right. Number one is just as it is illegal for you to disclose, it is also illegal for somebody to engage in risky sexual behavior without disclosure. Right? So there's a balance of odds here. Right? So there's 2 things that need to happen. You need to inform the person that has HIV/AIDS that they have also an obligation not to I mean, an obligation to not engage in behavior that could be considered risky. All right, which means not informing and whatever. However, the principle there is that you can encourage them to speak about it. There's no subtle way of saying. There's no technique, nothing of that sort, because the answer is very simply, we do not engage with it, right? There is a wonderful expression that I like to use with students very often when it comes to HIV/AIDS. It's, if you saw it, no, you didn't. If you know it, no, you don't. Right? That's the thing. You do not know anything for anything, right? If it means you literally go, sorry, what are you saying? I have no idea what you're talking about, right? Because you don't. The fact is, you do not know, and that's it, right? That's the starting point. It's rough. It's terrible, especially when you feel that they are going to endanger someone. You advise them and say, listen, there's a legal risk here, and this is not okay. But in terms of subtle, even hinting at somebody's status, you're even making big eyes whenever the letter H and I are next to each other, right? is not a thing, right? We cannot do that. And also, it's terrible, and it's happened, and there happens very often in therapy also, that you will see this person doing the worst possible things, and you have to just sit through it.
Can I come in?
Yes, of course.
Okay, so I can perform marriages, right? However,
Oh, yes, okay. I was
because
about to say
of
healings.
because of the Islamic family court, we have a clause that you have to go for premarital counseling before you get married. One of the terms and conditions that apply there is, if your your future partner wishes for you to get tested, it can be a deal breaker if you say no. So because these things are arranged, right? One of the things is that, like, I need to know if I'm getting a, obviously in inverted commas, clean partner that's not going to give me any sort of disease or anything that comes not only with HIV. It could be herpes, it could be crabs, it could be anything, lobsters, I don't know, all those things that come there. So yeah, if the partner says no, I don't want to, then we know that okay, this is not the right partner for me, because I have my doubts now. And then so you catch the next bus.
Yeah, that's a way to do it, that they can refuse. However, they cannot be forced either.
Yes, they can't be forced. They can't be forced. So like I say, the minute they say no, it's a deal breaker. Done.
Yes. Okay. I mean, that's a way society that can happen. Yeah. Yeah. And is that normal? Have there been any repercussions for it?
Not that I know of, because like most people, I think if all people say, yeah, let's go, because they're so duck in love and stuff, so they go for it.
Yeah.
And there hasn't been any comebacks for those who went. But like,
but do you have to go and disclose it to your partner, or do you just have to go for your own self? Because I don't think that's allowed.
Yes, you just have to go for your own self. No, you have to disclose, because if you don't disclose, then the person is going to always remain in doubt. So it's a deal breaker, and then it's clear, it's done.
So what is the repercussion for if you say, no, I don't have it, but you do?
Yeah, that's like, I don't know, because now you're going to have it, and how much time do you have to sue?
Like, I'm just wondering, because I mean, I know the results. It doesn't necessarily mean I have to be honest.
Yeah, I mean, people lie on many things, but yeah, so they're going to have to live with the repercussions.
Okay, that's an interesting approach. Yeah, that's definitely okay. Okay, I like it. It's different. I've never come across that, so I'm not quite sure like how it works in practice. It's an interesting thing. Okay,
I
so
think I have the
let's
document. I'll send
yes.
it through on the group. I have the
Please
document.
send it
I'll
through.
send it.
I would love to actually see how it all comes together.
Okay.
Because I think it's such a tricky, delicate space to be in. I'll be interested in seeing how it plays out.
Cool.
All right, let's look at important considerations for social work. So number one, confidence. Silence. You know nothing about statuses. You do not ever disclose statuses. That is not your space. Right. Number two, we remember all the suffering that the person is going through. Right. So dignity and human rights is in the middle of it all. Right. We never have tolerance for forced testing or forced disclosure. And ethical, we do not support that. Cultural sensitivity is also important. And this is where a social worker plays a huge role. A social worker has a beautiful view on tradition and cultural practices around their communities. So to be able to understand that maybe somebody wants to go see a traditional healer first and helping them understand the importance of medicine plus the traditional healer, and helping them integrate safe practices along with ART is quite important, right? Because people will always revert to their cultural understanding before the medical understanding. Does that make sense? People will always go towards their culture first. So understanding the culture and how to integrate it with the treatment plan is quite important. And then professional boundaries, right? So we don't get over involved. We don't share money and get financially entangled with stuff. And we never, ever, ever have an inappropriate relationship with a client or their family during this process. Right? Not because of the AIDS, but because there's a power relationship in place. Finally, self-care. You cannot look after yourself. You cannot look after your clients well enough. All right, next slide. Okay, let's do, Leanne, can you just show me the next slide after this? Okay, next one. Okay, perfect. Go back to you, please. All right, so now we've got the social worker at the center, so the client at the center and all their support structures. Then you have the social worker move to the center and they've got all of their structures. Now, let's quickly look at multidisciplinary teams, right? In a clinic, in an HIV clinic, who would be part of those teams? Moyabe, I haven't heard your voice for a bit. Who do you think should be a part of that team in a clinic for HIV treatment? Boule Van Roy, I'm going to ask you question 2 in a minute. Okay, so let's go. Moyabe?
Hi, Nick. I just think the social worker must be the part of the clinic.
But who, so social worker is the one person. Who else should they involve?
And the nurses and the family.
Okay, family representative, that can be a part of it, yeah.
Mhm.
The psychologist?
Yeah, okay, yes, sorry. And the psychologist, yeah, because he must give you he must give you the moral as a psychology. Yes.
Yeah. Okay. I've seen some sorry, I'm gonna have feedback from switches up in mute. I've seen some multidisciplinary teams where they even have the local traditional healer on there. They maybe have one of the religious leaders on there just to help integrate as much as possible into this person's support system as possible. So yeah, that's a good way. Bolle Van Roy, a concerned family member asks you for a client's recent HIV test results. So how do you respond ethically? Let's say, for example, I come to you and I say, listen, my daughter has been like losing a lot of weight. She's not looking well. I'm her father and I'm very worried about her, right? And I want to help her, Van Roy. I really do. and I know she came for HIV testing and she's been so depressed at home. All right. How can I assist her? Can you tell me about her test results? What do you say?
I would sit them down and tell them in a polite manner that I cannot disclose their test results. And as much as I do understand that as a parent, the father is highly concerned of their daughter's health and well-being, but I myself, as a social worker, my job is not to push and do anything that the the daughter or client does not want me to do, and that will be me disclosing personal information as her status. And it might be that that person is not ready to tell the family or tell the father. However, I would also try and see if I can maybe assist the parent by just telling them ways in how they can support, as they are saying that they've seen that the person has not been well, hence why they've now decided to go for HIV test. Health wise, they haven't been well for a couple of months, so I would actually try and get them to just show their support and show their love, and actually try, but not also to push the person to reveal their results, but just speak to the person and support them in every way. And then when the person is actually ready, she will then disclose her results in her own time, being the results are negative or positive. However, I'll also need to try and just maneuver sort of, as I'm speaking to the parent, I don't imply anything that might lead them to thinking that the person is actually HIV positive.
Yeah,
And
that's
all of that
important.
needs to be done, yes, in a way that it will still leave them not knowing the results, so
Excellent.
that they
A
do not
tricky one.
take
A
them.
tricky one.
That is an amazing
Perfect.
answer.
I
Well
think
done.
that's
You
it.
balanced.
It is an amazing answer, but it's a tricky one as well. May I say something? Or Sophia, you can go first.
Bule, are you from Durban?
Hi, Safia. I'm in Pietermaritzburg, just close to Durban.
Yeah, you sound like you're from that side of the world. That's all I wanted to say.
Oh, okay.
But excellent answer. Wow, I really liked it.
Excellent answer. However, if somebody comes to me, you got to be
Thank you.
so tactful about it, because if they're gonna come to me as a social worker and ask, is my daughter HIV positive or negative? And when the person is negative, you're gonna like excitedly say, no, 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 it's she's fine. But if you're gonna say like, I'm not allowed to disclose, already I know the answer. You
Okay.
understand? So you
So
have to your the way your approach is has to be tactfully, and it has to be spot on, that the person that is going to listen to you is in doubt. Are they positive or are they negative?
what I liked about the answer was that she redirected him. She
Yes.
said, you know what? I understand that you're worried. I cannot disclose it, but I see that you're worried about your daughter's health. So let's see
Yes,
how we can fix that rather.
yes.
So immediately moved on. Didn't sort of go like, oh, there's nothing to worry about there. Because that's not your story to tell.
Correct.
Right? Okay, perfect. Now
Yes.
let's up it a little bit more, Brule. I then say, as the father, I say, you know what? I understand you cannot tell me, but I've noticed that she has 3 boyfriends, and I'm worried that she's making other people sick. If she has HIV, that she's making other people sick. And I worry that, this is happening, and I can't live with that if that's the case, because what about these innocent people? Let's change that. It's not my daughter, it's my son. Maybe let's not classify women as the carriers there. It's my son. I've noticed he has 3 girlfriends, and I worry that they are going to get sick. What do you say to me then? If I say, but you're going to be responsible. If you know, I'm going to hold you responsible. What do you say, Buddha?
Well, I think in that case, I can try and then turn it on him without me having to disclose the person's status, because as the father, you have seen that your son has 3 girlfriends or more. Why have you not stepped in? And from the time you can see that your son is now into this dating thing, why are you not sitting your son down and then talking to your child and explaining how it goes in the dating scene, how the son needs to protect themselves, and just try and be a bit open as a parent with your child. Ask them, are they sexually active? And if so, are they using protection, stuff like that? And for you to be actually even telling me as a social worker that you have actually seen that your son is dating more than one person, but you have not tried to intervene and speak to them and try to get to know if they are protecting themselves, and even if they are sexually even if they are having intimacy with all of these people, you have not tried to speak to your son, meaning that you have seen the risk before your son actually came to myself as a social worker in order to see him. So I think in that way, I could just try and put it on him so that it does move on me.
Yes, I think you're going to make an amazing social worker. I think you're going to be very good at your job. I find
I think she's gonna make a good lawyer. She's good, man.
I find
You
what
know.
helps. No, it's good. It's good. You're doing very well there. I find what helps is because there are parents like that. Let me just clarify. There are parents like that do come through. I've experienced them in my practice multiple times. And what I usually try and do is I say, HIV/AIDS is probably one of the least worries that most people focus in on, right? The fact that your child or loved one is potentially having sex with so many different partners, there are a ton of different diseases that they can pick up, right? And not even with different partners. The fact that they're having sex with one partner and it might be unprotected, HIV/AIDS is one thing. There's many, many, many other things that they can pick up. And maybe that's a discussion that we should have, or that you should have with your child or the person you're worried about. Because yes, they've come to me for HIV/AIDS, or they've come to do this test and you know about it, that's fine. But there's so many other things that need to worry about. And therefore that approach is right, that you as a parent should have stepped in. You've done it very well there. I'm very happy with that response. Leanne, you had a question.
Yes, so I know when you get admitted to hospital and you're between the age of 16 and 18, your mother or father or guardian is still supposed to sign a letter for you to say that they give permission for you to undergo whatever, like a surgery or whatever.
Mhm.
So now my question is, in this case where you mentioned that the child's got HIV or might be positive, and as a social worker, and let's just throw out a random example, the girl is 16, are you still allowed to disclose the status with the parents because she is still a minor?
Never.
So even if she's a minor, you're not allowed to disclose it?
Never. No. All right. You do not disclose it. There is, I think it's under the age of 12 Then you have that discussion. I might be wrong about my ages. It's been long since I've worked in that space. But at a 16-year-old level, absolutely not. That is not disclosed. So a parent has to give permission for medical treatments, but I do believe that the testing still remains confidential. Right?
Yeah,
I
because-
might be wrong, but I do believe that it remains confidential.
No, the
At
reason
that
why
age.
I asked, sorry, the reason why I asked you is because even if they are 16 and they're going for abortion, there needs to, like the clinic or the hospital demands like a parent or a guardian or like someone that is taking care of you as a child, because you still like fall under the child bracket, even if it's not okay. It does classify as a medical procedure. I do understand that. It was just a bit confusing of keeping it a secret, and like they're still at the young age. So that's the main reason I'm asking.
From the age
So-
of 12, they have the
so
legal right
12
to
is-
say to consent.
Yeah. So 12 is the cutoff age, but there's a lot that we need to factor in there. Like, so for example, a 13-year-old who is quite smart and is together and has their stuff together is very different from a 13-year-old who doesn't, right? So you sort of have to take it case by case at that stage, but that's from 12 and above. Under 12, that's sort of a different story. But consent is important. I think it's easier to get consent from children, to be blunt. But at 16, even 14, I would say, does the child understand the test? Let that be your guide. And even then, you are playing very, very, very tough games with it, right? The guardian will have to consent to the test if the child is under 12 or lacks maturity, right? But after the age of 12, the child does have control independently. So they can control exactly what happens to their results. Right. It's a difficult one, and you'd have to work very hard as a social worker around.
Yeah, I think also the
balancing
legal
that.
age for a child to engage in sexual activity is 12.
Yeah.
Also.
Also, I know it's not an abortion lesson, so I won't engage in that discussion. But yes, they do require permission for an abortion. Strictly speaking, they shouldn't, and this is a trend that's come up a lot, which is a discussion to have another day.
Interesting next lesson.
On it, yeah. So that'll be something that we discuss at a future lesson. But for now, that is the guide. So anything with a child. Remember when we did the Children's Act, and I think we'll close on this. What is the number one rule for anything to do with a child according to the Children's Act? Anybody?
Best interest of the child.
There we
If
are.
I-
Everything we do must be in the best interest of the child. Now, remember we looked at the hierarchy of rights. Your right to dignity and your right to privacy trumps your right to disclosure or whatever else it may be. So go back to that lesson and review the pyramid of rights. What trumps which right? Right. So that is quite important to bear in mind. So if the child is not mature enough, and if the child maybe doesn't understand and you feel like this needs to be discussed, you then go to the multidisciplinary team and you guys have that discussion. So you as a professional are not taking that step alone, right? Because it's such a risky step. I would not take it. But if I felt like this child is a risk and they don't fully understand the test and they don't understand what it means, and I would then refer to the disciplinary team and we would take that decision together on how best to do it. All right, especially when it comes to access of care, access of treatment, that could be quite a big thing for children aged that. So there's a lot of factors. It's quite a complicated case here that you brought to us at the end of this lesson when my brain is tired. Thank you. All right. Perfect. So that is our section on dealing with HIV/AIDS. I'm going to very quickly, I know the lesson is over. I'm going to ask Leanne to show us the next slide, just so that we have it on the recording, which is a list of organizations that we can contact and what they do. You also have got a list of more localized organizations. I see Treatment Action Campaign is on there. Shakir, you mentioned them, right? But there's all sorts of different organizations there that can assist us. All right. Are there any questions that I can assist you with in terms of your understanding of HIV/AIDS and our response to HIV/AIDS, as well as what happens within the medico-bio-psychosocial domains?
Prevention is better than cure. Use the raincoat.
Always, 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 always. All right. Now,
No more
I'm
questions.
going to ask you quickly. I'm going to go quickly through each person, right? Safia, Shakir, we'll start here. Right. Are you struggling with anything in your modules? Are you good to go?
Good to go.
Good to go.
Good to go. Good to go. All right. What's the one thing you need to remember about HIV/AIDS that you're going to take home with you?
I know nothing. I hear nothing. I